Yes, I want to ask about that. That's the capability. The country will need the capability to report early, to detect and to determine that this is a new virus and we have to report it to authorities and we need a new response.
Yeah.
Do we have the capability? Does the Philippines have that capability?
So we've helped the Philippines have that capability. We've established the laboratory capacity by supporting the Philippines and the Research Institute of Tropical Medicine. We've provided the reagents and the chemicals. And so now you can do testing. If you remember, when
early testing.
Yeah.
Very important.
When your first case happened, you didn't have that capacity, right? You had to send samples for verification to our reference laboratory in Australia. Now you do your own testing. It reduces the time from 5 to 6 days to 2 days, right?
So we have the capability.
You have the capability. Now we are encouraging you to expand that, give more laboratories the capacity to do that so that you reduce the time required for patients to be held till their reports are coming.
So you can say that we're doing everything that's possible. I mean, you declared a global health emergency and a health emergency of international concern. Are there certain protocols involved there for preventive measures? And are we implementing all of them?
Of course, we are working with the Department of Health and the Philippine government to increase your preparedness and response capacities. So this is exactly what we are using this window for. We are helping you strengthen your efforts at containing this virus and possibly its introduction and establishment here. So,
like in quarantine capability, do we have sufficient facilities?
Yeah, I believe you have. You actually repatriated 48 or 52 people, including the staff who went to bring them, and you're holding them in New Clark City. So I think that is going well at the moment. We are working with the Department of Health to ensure that there's no spillover if there are positives among them.
We keep saying quarantine facility, and a lot of people really have no idea of how sophisticated should that be or how basic should that be. What goes into a good enough or if not an ideal quarantine facility?
So the quarantine facility required will depend on the particular disease, right? We were talking about airborne diseases, but this is not an airborne disease. If you're dealing with an airborne disease, then you need what you call a negative pressure chamber where the air from that isolation facility doesn't go out, right? In this case, because we consider this not an airborne disease, you don't need a negative pressure chamber. What you need is a room to isolate the patients where other people don't come into contact.
So separate rooms are good enough?
Yeah.
Okay.
No, I think we asked that because the communities around New Clark City are concerned about the use of the area for a quarantine facility.
Yeah, so I think they don't need to be unduly anxious. We understand that they are worried, but we believe that what is being done on the ground now is adequate.